Mr. Turner, I'm washing my hands with some sanitizer right now. My name is Amanda Sims. I am a nurse practitioner student here from Weber State University. What can I help you with today?
Just here for a checkup.
Here for a checkup. Awesome. Okay. Well, I'm going to start with your skin. But first, I'm going to note that you are making good eye contact. You don't seem in any visible distress. You're well groomed. There's no odors that are noticeable about you, which is great. You seem to be sitting comfortably. So first, I'm going to take a look at your skin and your hair and your nails. Have you had any problems with those whatsoever that you'd like to discuss?
I don't think so.
Okay. Well, I'm going to start with your head.
Okay.
So I'm going to look up here. It looks like you have some thinning and some balding. Is that pretty normal?
Mm-hmm.
No changes there? That's been pretty standard for what's been going on? Okay.
Yeah,
You
for
have,
the last 10 years.
awesome. You have a pretty distinct scar right here. What's that from?
Yep, that was basal cell carcinoma that was removed.
Okay. Did they do Mohs surgery?
Yep.
Okay. Awesome. His skin is dry and intact. I'm not noticing any lesions. Has some freckles on the face. And then arms. Let me see here. They all look good. Hands have some calluses on the inside. No lesions, no redness, swelling. Skin is warm and intact. This arm, the left arm, has a cyst, it looks like, about 1 centimeter. Hard, red. Does it hurt?
Sometimes. It doesn't hurt all the time, but if I hit it or brush it up against something, sometimes it'll hurt.
Okay. All right. Let me take a look at this other side. Is it bothering you? Is that something you'd like removed?
Not right now.
Okay. Patient does have some freckles and a couple of moles, but no issues that I'm noticing. What does your skincare routine look like?
I don't have any.
Okay. You just keep it clean?
Yep.
Yes. Do we use any lotions, soaps, or anything?
Just regular soap.
Okay. And having no issues with that at all?
Nope.
Awesome. Good to know. Okay. Next, we are going to take a look at your head. So you have normal cephalic. I'm not noticing any asymmetry. It looks very good. Do you have any issues with your nails?
No.
No issues with your nails?
Nope.
Okay. They look good, clean. Doesn't look like you are a nail biter, so that's good. Okay. No issues you'd like to talk about? No problem? Great. Okay, so next we're going to take a look at your eyes. So for the first part of the exam, we'll keep the lights on, but the next part we're going to dim the lights so that I can look inside them, okay? So eyebrows look good. They're symmetrical. His facial movements are symmetrical. And we're going to check your eye range of motion, okay? So I need you to keep your head straight on and follow my finger. Starting here. Okay, I'm not seeing any nystagmus. Good range of motion. No twitching. Okay, that looks great. Now I'm going to check your pupil response, okay? Just look straight on at my nose. Pupils are equal, round, and reactive. I'm noticing that the patient has a little yellowing with a kind of a bump on the inner aspect of his sclera of the left eye. Has that been something that's been there for a while?
Yeah, for at least a year or so.
Have you had it looked at?
Mm-hmm.
Okay, and what did the doctor say about it?
Said that it's common, that it's just the clear part of my eye buildup due to irritation, dust, wind, and the sun exposure and stuff.
Okay.
If I wanted it removed, I could get it removed, but other than that, it looks fine.
Okay. Is it bothering you currently?
Sometimes.
Okay.
It's day to day. Some days it'll be irritating me, and then some days I won't even notice it.
Okay, but right now we're okay? Not something you'd want addressed?
No, it's not bad right now.
Perfect. Okay, so the patient's eyelids look good. Good symmetrical movement. You don't have any debris, any pain. Your eyelids, okay. No redness. I don't see any styes. Eyes are moist. His sclera is nice and white. Irises look good. Okay, so what I'm I'm gonna do now is dim the lights, and I'm gonna check some of the things in your inner eye, okay? Hold on one moment. Okay, so first I'm gonna check for red reflex, just right here. I have a positive red reflex in both eyes. Okay, so now what I'm gonna have you do is I'm gonna have you look straight ahead. I want you to look at that corner right there, okay? And I'm gonna come just check here. Cornea looks nice and round. Positive half moon shape. Okay, and then same thing. So this is going to be a little bit hard. I'm going to hold your eye open because your eyes are going to be a little bit sensitive. I'm going to look inside your pupil, and I'm going to try to observe the inside structures, okay? It can be just a little uncomfortable for a minute, so just give me a minute, okay? Visualize the optic disc, the optic nerve, the vasculature. All looks healthy. Thank you. Sorry, I know that's uncomfortable. Now we're going to check the left eye. Let me check my thing here. Okay. All right. I'm going to hold your eye open again. Okay. I can see the optic disc, the optic nerve, and I can see the vasculature. Thank you. Sorry, I know that's uncomfortable. Okay. Perfect. Now I'll turn the lights back on. Sorry, gotta get that. Sorry, I know that was bright. Okay. Now we're gonna take a look inside your ears. I'm just gonna attach my otoscope here. So they're both symmetrical, normal distribution, normal alignment, normal anatomy. The patient looks good. You're not having any problems with your ears at all? No problems with hearing? No ringing in your ears?
No.
Okay, awesome. Okay, well, I'm going to take a look inside. Turn the light on here. So I just need to, I'm floating this in. Visualize the tympanic membrane. No redness, no swelling. The tympanic membrane is not bursting outward. I don't see any fluid or pus. The ear canal does have a little bit of whitish debris and cerumen. Otherwise looks really good. That's the left ear, the right ear. I'm gonna just float this in, pulling the ear back or the pinna. Okay. I can also see the tympanic membrane on this side. There's a little more of that whitish debris on the inside. No redness. No swelling out, no fluid or pus or anything that I can see. Okay. All right, now I would like to take a look inside your nose. So I'm just going to take a look. Let me turn my light on here. I'm going to look up your nose, so go ahead and thank you so much. Just put it up there for a minute for me. Okay. The mucosa is pink and moist, looks healthy, no redness, no tearing, no septal deviation, nice and straight. Same on the right side. Patient's nose looks good. Okay. And then let's take a look at your mouth now. So first I'm going to take a look at your jaw. Do you have any issues with motion in your jaw?
No.
No? Okay. Can you open and close for me? Okay. So you have some clicking.
Yep.
Does that happen all the time?
Yeah.
Is there any pain with that?
No.
And it's just when you open?
Yep, just when I open my mouth.
Okay, perfect. That's interesting. Okay. All right. Now I'm going to take a look inside your mouth. Soft and hard palate are intact. Oral mucosa is pink and moist. Tongue is normal size, pink and moist. Good dentition. Has some fillings. Do you see a dentist regularly?
Mm-hmm.
Okay, can you lift your tongue for me? Underneath the tongue is also pink and moist. I don't see any lesions, no sores. Can you say ah? All right, oropharynx looks good. There is no redness, there's no swelling. Uvula is midline and not swollen. Okay, thank you. You having any problems with your throat?
Nope.
Okay. All right, so now I'm going to take a look at your lymph nodes. So first we have your pre-auricular lymph node here, and then your post-auricular, occipital, and tonsillar, submandibular, submental, anterior cervical, and posterior cervical. And all of those feel normal. I don't feel any masses, nodules. And as I move down here, his trachea is midline, no deviation noted. Can you swallow for me? Awesome. Okay. Palpating the thyroid. No swelling, no nodules or masses noted. And his supraclavicular nodes are also normal. No masses or nodules palpated at all. Okay, next we're going to have you, I'm going to check your range of motion in your neck. So what I want you to do is to flex your neck down as far as you can go. Do you have any pain with that?
No.
Okay, cervical spine looks good in alignment. Okay, now I want you to hyperextend this way. Any pain there? Okay, perfect. And then can you rotate to the right all the way and rotate to the left all the way? Perfect. Then I'm going to have you tilt your head to the side. So can you go right and then to the left? Any pain with all of that?
No.
Perfect. Okay, well, patient has good range of motion in his neck. You look really good, Mr. Turner. Do you have any questions for me?
Nope, I don't think so.
Awesome.